Imagine your boxer doing those massive chaotic zoomies around the backyard.
Oh yeah, just completely full of life.
Exactly, tearing up the grass, pivoting on a dime. It's a beautiful sight. But what if I told you that that exact burst of endless explosive energy could actually be masking a silent, ticking clock right inside their chest?
I mean, it is a really jarring thought. We look at that raw athleticism and we automatically equate it with perfect health, right? Like assuming if a dog is running that hard, everything inside just must be functioning flawlessly.
Right. So welcome to today's deep dive. We are looking at a stack of veterinary transcripts and research notes today, profiling the specific health landscape of the boxer dog.
And it is quite a landscape.
Yeah, let me just say, if you were bringing this breed into your life, or, you already have one, reading through this list of canine health risks, I mean, cancer, heart disease, bloat, it feels incredibly overwhelming. It really reads like a worst-case scenario playbook.
Which is completely understandable. When you just stare at a list of genetic predispositions, it is so easy to feel paralyzed by all the things that could potentially go wrong.
So what does this all mean? The mission for this deep dive is to completely reframe this information for you. This is not the scary deep dive.
No, it's definitely not.
We are here to transform that fear into active empowerment.
And my core belief has always been that knowledge is really only valuable when you can apply it practically. Understanding a boxer's genetic predispositions is never about bracing for the worst or living in constant anxiety.
Right, nobody wants that.
Exactly. It's about knowing your individual dog's baseline. When you know what is normal for your dog, you can catch those really subtle changes early. And catching things early, well, before they become catastrophic, is exactly when veterinary interventions actually work best.
Okay, let's unpack this, starting with that ticking clock I mentioned earlier.
The cardiovascular system.
Yeah. The boxer is a working dog, originally bred from the Bullenbeißer, built to take down large game. They are pure muscle and drive. But that same powerful cardiovascular system driving all that muscle is, ironically, their greatest hitting vulnerability. The sources specifically highlight something called Boxer Cardiomyopathy.
Yeah, and the fact that the veterinary community practically named a heart condition after this specific breed, well, that should tell you just how deeply documented this predisposition is. The clinical term is arrhythmogenic right ventricular cardiomyopathy, or ARVC for short.
That's a lot of syllables.
It really is.
Let's break down what is actually happening in the dog's chest, because if I understand the notes correctly, this isn't a plumbing issue like clogged arteries, right? This is an electrical issue.
That is a great way to look at it. The heart is a muscle that relies on highly precise electrical signals to tell it exactly when to squeeze and pump blood.
Okay.
And in a dog with ARVC, the normal heart muscle cells, specifically in the right ventricle, they just begin to die off, and the body replaces them with fatty or fibrous scar tissue.
And fat doesn't conduct electricity the way healthy muscle does. I mean, it's like owning a high-performance sports car, right? A massive engine means you need specialized diagnostics, not just a standard oil change.
Absolutely.
And if we look at it like having frayed wires in a house, the electrical current hits that patch of fat, shorts out, and the rhythm of the heart just misfires.
That frayed wire analogy is spot on. When that electrical signal gets disrupted by the fatty tissue, you get arrhythmias, which are basically irregular heartbeats.
Right.
The heart might skip a beat or suddenly beat incredibly fast and chaotically.
But let me challenge this, because I know what you, the listener, are thinking right now. Going back to our backyard zoomies, if my boxer's heart is short-circuiting, how on earth are they still running laps? Surely their heart is fine if they have endless energy, right?
It seems totally counterintuitive, I know. But early-stage ARVC usually presents with absolutely zero outward signs.
Like, really? It's not at all.
None. The heart is incredibly resilient, so it compensates for those occasional electrical misfires. A dog can have a heavily compromised electrical rhythm and still summon the adrenaline and energy to run those laps.
Wow.
Yeah, their day-to-day enthusiasm doesn't change until the disease has progressed dangerously far.
So you can't just wait until they look tired or start coughing.
Exactly. If you are waiting for visible symptoms, which typically look like sudden weakness, or an episode where they briefly faint and collapse after getting overly excited, you are catching it very late in the game. That is why proactive, specialized screening is mandatory.
Right. The source's mission, Holter monitoring. But how does that actually work for a dog? I mean, I'm picturing a dog tangled in wires at a hospital.
It's actually much more manageable than that. A Holter monitor is just a small, portable device attached to the dog's chest with a snug little vest.
Okay. That makes sense.
Yeah, they wear it at home for 24 hours to continuously record their heart rhythm while they sleep, play, and eat. It gives the cardiologist a full picture of those electrical signals under normal stress.
Rather than just a 2-minute snapshot in a quiet exam room.
Precisely. And they usually pair this with an echocardiogram, which is an ultrasound, to visually check the physical structure of the heart.
Wait, if the echocardiogram checks the structure, that brings me to something I'm a bit confused by in the notes. The sources mention dilated cardiomyopathy, or DCM, right alongside ARVC. Are these just two different names for the same heart failure, or are we looking at a completely different mechanical breakdown?
They are completely different mechanisms. So we established ARVC is an electrical short circuit caused by fatty tissue.
Right.
DCM, on the other hand, is a structural failure. The heart chambers actually stretch out and become enlarged, and the walls of the heart muscle become thin and weak.
Oh, wow.
Yeah, it basically becomes a floppy balloon that simply cannot contract hard enough to pump blood efficiently.
And the sources flag a really specific environmental trigger for DCM involving diet. Something about grain-free dog food.
This is a massive area of ongoing veterinary research right now. Boxers already have a genetic predisposition for DCM, but studies have shown a potential compounding link between DCM and certain grain-free diets.
Like the ones that replace grains with peas and lentils.
Exactly, specifically those with high concentrations of legumes.
But how does a lentil hurt a dog's heart? That seems so random.
Well, the leading theory is that these high legume formulations might interfere with how the dog synthesizes or absorbs taurine and other essential amino acids.
Okay.
And taurine is absolutely critical for maintaining heart muscle strength. So you take a boxer who is already genetically vulnerable to a weak heart muscle, and you feed them a diet that potentially starves that muscle of the very amino acid it needs to stay strong. Well, you create a perfect storm for DCM.
That is wild. It really drives home that you can't just follow trends with dog food.
Absolutely not.
The sources also briefly mention aortic stenosis.
Yes. So think of the aorta as the main garden hose carrying oxygen-rich blood out of the heart to the rest of the body. Aortic stenosis is a physical narrowing at the valve of that hose.
So the heart has to squeeze much harder to force the same amount of fluid through a smaller opening.
Exactly, the physics of it. And when fluid is forced through a narrow opening, it creates turbulence.
And a vet can hear that.
Yeah, a veterinarian can actually hear that turbulence through a stethoscope. It sounds like a whooshing noise, which is what we call a heart murmur. This is a classic example of why annual physical exams are so vital. Your vet might hear that murmur years before the dog shows any signs of fatigue.
All right, so that is the cardiovascular engine powering the dog. But logically, if you have a dog with that kind of explosive muscular output, we have to talk about the physical frame absorbing all that shock.
Right, the chassis, the joints and bones.
Exactly. That athletic power takes a massive toll on the body. Boxers are heavily muscled dogs, and that brings us to their orthopedic vulnerabilities. And the most prominent one in the sources is hip dysplasia.
Which most people have at least heard of.
Yeah, most people know the term, but let's break down the mechanics for a second. The hip is a ball and socket joint, right?
It is. In a healthy hip, the ball at the top of the leg bone fits deeply and snugly into the socket of the pelvis, gliding smoothly.
Makes sense.
But with dysplasia, the joint fails to develop properly. The socket might be too shallow or the ligaments too loose. So as the dog moves, that ball rattles around in the socket instead of gliding.
And that rattling causes microtraumas to the cartilage, I imagine.
Over time, yes. That constant abnormal friction wears away the protective cartilage, leading to inflammation, pain, and eventually chronic arthritis. Now, genetics play a dominant role in whether a boxer's hips are built correctly, but the sources emphasize something crucial here. Genetics are not destiny.
You mean environmental factors can actually change how those genes express themselves?
Yes, it's a concept called epigenetics. The environment heavily influences whether those bad hip genes get activated.
Okay, how so?
Well, if you have a boxer puppy with the genetic marker for loose hips, and you let them become overweight, or, you let them do high-impact activities like constantly jumping off porches or running on hard pavement while their skeleton is still forming, you are going to exacerbate that looseness.
You physically alter the development of the joint.
Exactly.
So keeping a puppy lean and managing their exercise can physically prevent the worst of the genetic disposition from manifesting. I mean, that is hugely empowering.
It really is.
But I want to push back on something here because I hear this from dog owners constantly. They say, My dog isn't limping, so their joints must be fine.
What's fascinating here is that waiting for a limb is a terrible strategy.
Really? Why is that?
Dogs are incredibly stoic animals with deep survival instincts. Showing pain makes them vulnerable.
Oh, right.
So limping is actually a late-stage sign of joint failure. By the time they are actually holding the leg up, the cartilage damage is usually severe.
So what are the early warning signs? What should you actually be looking for in the backyard?
You have to look for compensation behaviors. Watch for a bunny hopping gait when they run, where both back legs push off together rather than striding independently.
Because that minimizes the rotation in the hip.
Exactly. Also look for stiffness when they first get up from a nap that slowly eases as they walk around. Or pay attention if a dog who used to confidently jump into the back of your SUV suddenly hesitates or waits to be lifted.
That makes a lot of sense. And it isn't just the hips taking the impact. The notes also highlight cranial cruciate ligament disease, which is basically the dog equivalent of an ACL tear in a human knee, right?
It is. And the biomechanics of the boxer make this incredibly common. Remember, they don't just run in straight lines. They are known for their playful boxing-style movements.
Right, they juke, they pivot, they twist.
And the knee is just a hinge joint. It is designed to swing forward and backward, not rotate side to side.
Ah, I see where this is going.
Yeah, when you have a heavy 60-pound muscular dog running at full speed and they suddenly plant a foot to pivot, all of that rotational torque goes directly into the cruciate ligaments, stabilizing the knee.
Ouch.
Yeah, it can cause an acute, sudden tear, or it can be a gradual fraying over time.
And what's the telltale sign of a cruciate tear?
Sudden lameness in a hind leg, usually right after a burst of activity. They might refuse to put their toe on the ground at all.
And that requires immediate vet attention, I'm assuming.
Yes, to stabilize the knee, or the other leg will eventually tear from carrying all the extra weight.
Okay, so we've looked at the heart pumping the blood and the joints taking the mechanical stress. Let's connect that physical output to how the boxer actually fuels it. Here's where it gets really interesting, because we have to talk about the physical shape of the dog, specifically their airway and their deep chest.
Right. Anatomy dictates risk. Let's start with the face. Boxers are brachycephalic, meaning they have a shortened muzzle and a pushed-in face.
Although the sources do note they are on the milder end of that spectrum compared to, say, a French bulldog or a pug.
They are milder, but that shortened skull still fundamentally alters their airway dynamics. The tissues inside the nose and throat don't magically shrink just because the snout is shorter.
Right, so you have the same amount of soft tissue crammed into a much smaller space.
Exact.
Which explains the snorting and the snoring. The soft palate in the back of the throat is too long for the shortened mouth, so it flaps and vibrates when they breathe.
That vibration is exactly what causes the noise. And this leads to a very dangerous myth we really need to dispel today.
Which is?
That loud, labored breathing is just normal for the breed.
Oh, I hear people say that all the time. They laugh at a struggling dog and say, oh, he's just being a boxer.
And it's so risky. A little bit of noise when they are deeply relaxed or lightly playing is expected, but persistent struggling breaths is a sign of an obstructed airway.
How can an owner tell the difference?
If your dog is using their stomach muscles to heave air in, or if they take a long time to settle their breathing after a walk, especially in heat or high humidity, they're struggling to oxygenate their body.
Because dogs don't sweat.
Yeah.
Right, they cool down by panting.
Exactly. If their airway is obstructed, they can't cool down, leading to rapid heat stroke. It is not something to ignore. Vets can actually perform minor surgeries to widen the nostrils or shorten that flapping, soft palate.
Wow. Okay, that moves us from the face down to the chest. The boxer has a very distinctive silhouette. Broad shoulders dropping down into a very deep, narrow chest.
Yes.
And this shape triggers one of the most terrifying conditions in the veterinary transcripts, gastric dilatation volvulus, or GDV, though we usually just call it bloat.
Bloat is arguably the most critical, acute emergency a dog owner can ever face.
Let's walk through the mechanics of what is actually happening during a bloat episode.
Well, the deep-chested anatomy creates a physical void where the stomach sits. It's essentially suspended like a hammock. The dilatation part comes first. The dog eats a large meal, or maybe gulps a massive amount of air while eating rapidly. The stomach begins to fill with gas and expands like a balloon.
Which is painful, but not necessarily deadly on its own.
Right. But because that expanded stomach is suspended in that deep chest cavity like a hammock, the weight of the food and gas can cause the entire organ to swing and physically flip over on itself.
Oh, man.
That is the volvulus phase.
So it twists the entry and exit points completely shut.
It seals the gas inside with nowhere to go, and far worse, that twisting action pinches off the major blood vessels, including the vena cava, which returns blood to the heart.
Yeah, sounds catastrophic.
It is. The stomach tissue begins to die from lack of blood, and the dog goes into systemic shock.
Okay, let's put the listener right in this scenario, because this is all about practical empowerment.
Yeah.
I'm sitting in my living room at 10 p.m. My boxer just ate a big dinner. What specific signs am I looking for to know this is happening? And honestly, how much time do I have?
You do not have time. This is measured in minutes and hours, not days. Okay.
The hallmark sign you will see is unproductive retching. The dog will look and sound like they're trying desperately to vomit, but nothing will come out because the stomach is twisted shut.
That's terrifying.
You will also likely see a visibly distended, hard abdomen right behind their rib cage. And their behavior will be frantic, pacing, panting, completely unable to lie down comfortably.
So if you see this, you don't wait for morning.
You drive to the emergency vet immediately. Do not wait.
And how do we actively prevent this acute emergency in the first place?
The sources outline a few critical, actionable takeaways for your home. First, you force them to eat slower, using puzzle feeders or slow feeder bowls with ridges in them.
Okay.
You break their daily food into 2 or 3 smaller meals rather than one massive bowl. And most importantly, you enforce a rest period.
Meaning no vigorous exercise.
Exactly. No running or heavy play for an hour before and an hour after they eat. You want that stomach empty and stable before they start jumping around, which is such an easy, actionable routine to implement. All right, we've covered the cardiovascular mechanics, the orthopedic structure, and the anatomical risks of the airway and chest. To round out this health profile, we really have to zoom all the way in to the micro level, the cellular risks.
We have to talk about cancer.
Yeah, it's the elephant in the room. And ignoring it doesn't protect your dog. The sources list 3 specific predispositions for boxers: mast cell tumors on the skin, lymphoma in the lymphatic system, and brain tumors.
Let's focus on mast cell tumors because these seem uniquely tricky.
What actually is a mast cell?
A mast cell is a normal part of the dog's immune system. They're essentially little factories that store histamine. So when a dog gets a mosquito bite or has an allergic reaction, mast cells release that histamine to cause inflammation and send white blood cells to the area.
So they're supposed to be helpful.
Normally, yes. But in boxers, these cells have an unusually high rate of mutating into tumors, usually on or just under the skin. And what makes them incredibly dangerous is that they are absolute masters of disguise.
The notes say they frequently masquerade as benign fatty lumps called lipomas.
They look and feel exactly the same. You cannot diagnose a mast cell tumor just by massaging it with your fingers.
Wow.
Furthermore, because these tumors are packed with histamine, if you squeeze them or if the dog scratches them, the tumor can suddenly dump massive amounts of histamine right into the bloodstream, causing systemic shock or severe gastric ulcers.
This directly challenges a massive misconception out there. People assume that because their dog is young, say 2 or 3 years old, any lump is just a harmless fatty deposit. They think only senior dogs get cancer.
That is a deadly assumption with a boxer. Boxers are notorious in veterinary oncology for developing mast cell tumors at surprisingly young ages.
So if you are petting your 3-year-old boxer on the couch and you feel a lump the size of a pea under the skin, what is the protocol?
Well, you do not panic because dogs do get harmless cysts, but you absolutely must abandon the old school, let's wait and see if it gets bigger approach.
Right.
You make an appointment, the vet takes a tiny needle, extracts a few cells, and looks at them under a microscope. It is a fast, simple procedure called a fine needle aspirate or biopsy.
It is exactly like the check engine light illuminating on your car's dashboard.
Yes.
That light might just mean your gas cap is loose. Annoying, but harmless.
Yeah.
Or it might mean your transmission is about to fail. But you don't just put a piece of black tape over the light and drive on hoping for the best.
Exactly. You take it into the shop, plug in the diagnostic reader, and find out what you're dealing with. If we connect this to the bigger picture, this entire medical landscape we've just traversed is exactly why responsible breeding and proactive care are so vital.
Explain how responsible breeders actually mitigate these cellular and genetic risks. Because they can't just edit the DNA.
No, but they can rigorously filter the gene pool, Ethical breeders use Holter monitoring on their breeding dogs to ensure they aren't passing on ARVC. They get the hips x-rayed and scored by orthopedic specialists to ensure they aren't breeding dogs with dysplasia. They use genetic testing for known markers.
So it doesn't guarantee a perfect dog, but it dramatically stacks the deck in your favor.
Precisely.
So for the listener sitting at home looking at their boxer right now, what is the ideal proactive routine?
It is all about tracking baselines. You need consistent annual vet visits, transitioning to biannual visits as they hit their senior years around age 7.
Okay.
You want routine blood work to catch subtle shifts in organ function. And you really need a system to track this data.
The sources highly recommend using an organizational tool, like the mentioned VitalPet app, to track everything.
It is a game changer. If you rely on your memory, you might not notice that your dog has slowly lost 3 pounds over the last 8 months, or that their respiratory rate while sleeping has slowly ticked upward.
But when you chart it in an app, the trend becomes obvious.
Exactly. You become a true partner with your veterinarian.
All right, let's circle back to the core mission we started with. We have thrown a lot of heavy terminology around today. ARVC, GDV, mast cells, epigenetics.
It's a lot to take in.
It is. But the ultimate takeaway from all these sources is this: genetics loads the gun, but your awareness, your lifestyle choices, and your preventive care dictate whether it fires. The physical body of the boxer is a complex, high-performance machine. But leaning into that complexity, rather than hiding from it in fear, is what empowers you to give your dog a joyful, active, and long life.
It truly is about being an observant partner. And actually, that concept of observation leads me to a final thought I'd love to leave you with.
I love a good final thought. Lay it on us.
We spent this whole time discussing how early physical ailments, like a fraying cruciate ligament or the onset of early-stage heart disease, are incredibly subtle, often presenting with zero obvious physical signs.
Right, no limping, no coughing.
But boxers are famous for their highly attuned emotional intelligence and their bond with their owners.
You are very communicative dogs.
Exactly. So I want you to consider this. Could a sudden, unexplained behavioral change, like a newly developed anxiety around loud noises, an unexpected stubbornness on walks, or a sudden snappy reactivity toward other dogs, actually be the very first symptom of a hidden physical discomfort?
Wow, so they aren't acting out because they forgot their training. They're acting out because they are masking pain.
Precisely. Pain drains a dog's threshold for stress. Before you assume your dog needs strict behavioral discipline or a new trainer, perhaps you should first ask if they are silently trying to tell you that something inside their body hurts.
That completely changes how you interpret their actions. Sometimes the check engine light isn't a limp. Sometimes it's a sudden bout of anxiety or a refusal to sit on command.
It is all connected.
Well, thank you so much for guiding us through this. Navigating the physical health of a boxer is a major journey. But if you are listening, you are now armed with the exact knowledge you need to do it right. And speaking of behavior and communication, the next step in our journey through the sources will explore exactly that: the brilliant, deeply expressive mind and behavior of the boxer. You will not want to miss it. See you next time.